Today topic of discussion hospital acute infection. What is hospital acute infection? Infection occurred in healthcare settings are among the major causes of death and increased morbidity among hospitalized patients. Hospital acute infection are significant burden both for the patient and for public health. So it have significant burden both patient and for public health. Those infection which were not present in a person at the time of admission to the hospital but are occurred during a stay in a hospital are considered as hospital acute infection. After 24-hour admission only it will cause hospital acute infection add to functional disability and emotional stress of that patient, and in some cases may lead to disabling condition that reduce the quality of life. Nosocomial infection are also one of the leading causes of death. Prolonged stay not only increases direct cost to the patient but also indirect cost due to loss in the work. Many different pathogens may cause nosocomial infection. The infecting organism vary among different patient population, different healthcare setting, different facilities and different countries. Factors that promote nosocomial infection, they include age, immune status, underlying disease, and diagnostic and therapeutic interventions. The extreme of life, that is infancy and old age, are associated with a decreased resistance to infection. Patient with chronic diseases such as malignant tumor, leukemia, diabetes mellitus, renal failure or AIDS have an increasing chances for opportunistic pathogen, increasing chances to infection with opportunistic pathogen. Then immunosuppressive drugs, then irradiations and malnutrition may lower resistance to infections. Injury to skin or mucous membrane also affected natural defense mechanism. Many modern diagnostic and therapeutic procedures such as endoscopic examination, catheterization, intubation, ventilation, then suction, and surgical procedures increasing the risk of infections. Patient with infection or carrier of pathogenic microorganism admitted to hospital are potential source of infection for patient and staff. So the patient with infection or carrier of pathogenic microorganism admitted to hospital are potential sources of infection for patient and staff. Microorganisms, many different bacteria, virus, fungi, parasite causes nosocomial infection. Infection may be caused by microorganism acquired from another person in the hospital, that is cross infection, or may be caused by the patient own flora, that is endogenous infection. Some organism may be acquired from inanimate object or substances recently contaminated from other human source and is known as environmental infection. Organism causing nosocomial infection can be transmitted to the community through discharged patient, staff, and visitors. If organisms are multi-drug resistant, they may cause significant diseases in the community. Most infections occurred in hospital today are caused by microorganisms, which are common in the general population in whom they cause no or milder disease than among hospital patients. Example Staphylococcus aureus, Enterococci, and other members of the family Enterobacteriaceae. Next, specific nosocomial infection. The most common type of nosocomial infection include infection of lower respiratory tract, skin, urinary tract infection, and bloodstream infection. So first one is urinary tract infection, the most common nosocomial infection. 80% of urinary tract infection are associated with the use of indwelling bladder catheter. Urinary infection are associated with less morbidity than other nosocomial infection, but can occasionally lead to bacteremia and death. It leads to bacteremia and death. Infection are usually diagnosed by presence of two isolated microbial species or a positive quantitative urine culture, whereas more than or equal to 105 microorganisms per ml of urine sample are seen. More than or equal to 105 microorganisms per ml of urine sample are seen. The bacteria responsible for urinary tract infection arises from the gut flora like Escherichia coli or occurred in hospital like multi-drug resistant Klebsiella. Second one is surgical site infection. Surgical site infection are also frequent and the incidence varies from 0.5 to 15 percentage depending on the type of operation and underlying patient status. These infection causes significant problem and limit the potential benefits of surgical interventions. The surgical site infection also have impact on hospital cost and post-operative length of stay may extend between 3 and 20 additional days. The diagram is there. Stay extend 30 to 20 additional days. So the extend day 20 days. The patient suffer from fluent discharge around the wound or the insertion site of the drain or spreading cellulitis from the surgical wound. The infection is usually occurred during the operation itself, either exogenously from the air, medical equipment, surgeon, or other staffs, endogenously from the flora of skin and body. The main risk factor is the time taken to do an operation and the patient general condition. Other factors include the quality of surgical technique, the presence of foreign bodies include drain, the virulence of the microorganism, and use of preoperative saving. Staphylococcus aureus, the main pathogen. Staphylococcus aureus are the main pathogen responsible for this type of hospital acute infection, followed by Escherichia coli, Proteus, Enterococci, and Staphylococcus epidermidis. So these one Staphylococcus aureus main pathogen responsible for this hospital acute infection, followed by E. coli, Proteus, Enterococci, and Staphylococcus epidermidis. Third one is nosocomial pneumonia. A nosocomial pneumonia occur in several different patient group and is quite common. The patient on ventilator in intensive care unit suffer from this type of hospital acute infection. There is high cause mortality rate associated with ventilator associated pneumonia. The microorganism like Haemophilus influenza, Staphylococcus pneumoniae, Staphylococcus aureus, Proteus, Enterobacter, and Klebsiella enter the throat during treatment procedure given to patient with obstructive lung disease. So the high death rate associated with the ventilator associated pneumonia, the microorganism like because of Haemophilus influenza, Streptococcus pneumoniae, Staphylococcus aureus, Proteus, Enterobacter, Klebsiella enter the throat during treatment procedure given to patient with obstructive lung disease. Microorganism colonies in the stomach and quickly colonize the upper respiratory airway and bronchi and causes infection in the lungs causing pneumonia. So microorganism colonies in the stomach and quickly colonize the upper respiratory airway and bronchi and causes infection in the lungs causing pneumonia. The infection would be exogenous from contaminated respiratory equipment. The infection would be exogenous from contaminated respiratory equipment. The system of pneumonia. The symptoms of pneumonia. The symptoms of pneumonia include purulent sputum and onset of fever. What are the symptoms? Purulent sputum and onset of fever. A diagnosis is more specific by bronchoscope. The common risk factor for nosocomial pneumonia include the type and duration of ventilation, the quality of respiratory care, severity of the patient condition like in case of organ failure and previous use of antibiotics. Apart from ventilator associated pneumonia, patient with seizure or decreased level of consciousness or the risk for nosocomial infection. Next, nosocomial bacteremia. Approximately 5% of patients admitted in the hospital have nosocomial bacteremia, but cases that mortality rate are high. The incidence is increasing, particularly for sudden organisms such as multi-drug resistant coagulase negative staphylococcus and candida species. So in this nosocomial bacteremia condition, the incident is increasing because of coagulase negative staphylococcus and candida. Infection may occur on the skin. Infection occur on the skin at the entry site of the intravascular device or in the subcutaneous path of the catheter known as tunnel infection. It is known as tunnel infection. So what is tunnel infection? Infection may occur on the skin at the entry site of the intravascular device or in the subcutaneous path of the catheter is known as tunnel infection. Organism colonizing the catheter within the vessel may produce bacteremia without visible external infection. Bacteremia without visible external infection. The sources of infection is resistant. The main risk factor are length of catheterization, level of asepsis at insertion and continuous catheter care. So what are the three things? The risk factor, length of catheterization, level of asepsis at insertion and continuous catheter care. Other healthcare associated infection, skin and soft tissue infection. In case of open sore ulcer, burn, encourage bacterial colonization and may leads to systemic infection. Then gastroenteritis is the most common nosocomial infection in children and rotavirus is chief pathogen. Then Clostridium difficile is the major cause of nosocomial infection. Gastroenteritis among adult in developed countries. Next, microorganism. First one is bacteria. There are the most common nosocomial infection. These bacteria causes most common nosocomial infection. The commensal bacteria found in normal flora of healthy human have significant productive role by preventing colonization by pathogenic microorganism. Some commensal bacteria may causes infection if a person is immunocompromised. Example, cutaneous coagulase negative staphylococcus causes bloodstream infection. Example, cutaneous coagulase negative staphylococcus causes bloodstream infection that is attributed to an intravascular catheter infection. And intestinal E. coli are the most common cause of urinary infection. Second one is intestinal E. coli are the most common cause of urinary infection. Then pathogenic bacteria are more virulent and causes infection. Gram-positive bacteria like aerobic clostridium causes gangrene. Staphylococcus aureus cause a wide variety of lung, bone, heart, bloodstream infection and are frequently resistant to antibiotic too. So gram-positive bacterium like Clostridium causes gangrene, Staphylococcus causes lung, bone, heart, bloodstream infection. Then gram-negative bacterium. Gram-negative bacterium like Enterobacteriaceae members that E. coli, Proteus, Klebsiella, Enterobacter causes serious infection of surgical site. There are causes serious infection of surgical site, lungs, bacteremia and peritoneum infection. Next microorganism, virus. These are the possibility of nosocomial transmission of many viruses including hepatitis B and C viruses which are transmitted during transfusions. Dialysis, injection and endoscopy. How these viruses transmitted during the time period of transfusion, dialysis, injection and endoscope. Respiratory syncytial virus, rotavirus and enterovirus that are transmitted by hand to mouth contact. So that RSV, rotavirus, enterovirus transmitted by hand to mouth contact via fecal oral route and also causes hospital acute infection. Other viruses such as cytomegalovirus, HIV, Ebola, influenza virus, herpes simplex virus, varicella zoster virus also transmitted. Next, parasites and fungi. Some parasites, example, Giardia lamblia, are transmitted easily among adult or children. Many fungi and other parasites are opportunistic organism and causes hospital acute infection. Fungus include like Candida albicans, Aspergillus species, Cryptococcus neoformans, and Cryptosporidium. These are the fungus causes nosocomial infection. Next, preventions of hospital acute infection. In order to prevent hospital acute infection, specific policies and practice to prevent these infections are recommended. In the case of urinary tract infection means the removal of indwelling catheter, if possible, may result in spontaneous resolution of bacteriuria or asymptomatic cystitis. Antibiotic and antifungal therapy should be considered. Antibiotic and antifungal therapy should be considered to avoid major complications, include pyelonephritis, renal damage, and bloodstream infections. Although duration of the therapy is controversial, but some expect recommended at least 10 to 14 days of therapy for children with sepsis, pyelonephritis, or urinary tract abnormalities. So 10 to 14 days therapy at least recommended. Implementation of interventions like limiting duration of catheter use, aseptic technique at the time of insertion, and maintaining closed drainage is effective to reduce the catheter associated urinary tract infection rate. Next, prevention of surgical site infection. Surgical site infection should be managed with a combination of surgical care and antibiotic therapy. So here, use of antibiotic approximately maintain normal body temperature, maintain normal glucose level, avoid shaving site, and other basic preventions. Then nosocomial pneumonia. To check the ventilator associated pneumonia, aseptic intubation and suctioning, limit duration of ventilator, and using non-invasive ventilation technique help in reducing the infection. In other type of nosocomial pneumonia, usage of sterile water for oxygen and aerosol therapy along with isolation policy helps in managing the infection. Initially, broad spectrum antibiotic therapy is given. And later it is streamlined on the basis of identified organism and antibiotic susceptibility test. Attention is given to the risk of multi-drug resistant pathogen. Antiviral medication against influenza for symptomatic patient. Antiviral medication against influenza for symptomatic patient and patient with immunodeficiency or chronic lung disease is provided to limit morbidity and mortality. To exposure that fungal spore during construction or renovation should be avoided in neutropenic or transplant patients. Next, bloodstream infection. Healthcare provider must be properly trained. Aseptic technique must be followed strictly to avoid sepsis. If the infection suspected, then the duration of the catheter use should be limited. Hand washing technique must be followed. The washing and disinfection of the insertion site with the antiseptic solution is recommended. If the local infection or that local infections, the catheter should be removed immediately. Surgical asepsis rules must be followed by healthcare provided using antibiotic coated catheter for short term use in helpful. Other healthcare associated infection, rotavirus gastroenteritis is the self-limited disease and only need supportive care. Medical management should be focused on preventing dehydration. Treatment is not necessary for asymptomatic carrier of Clostridium difficile. Clinical improvement is usually seen within 2 days of initiating therapy, and the duration of treatment is generally 10 days. Next, treatment of nosocomial infection. Symptomatic treatment of shock, hypoventilation, and other complications should be provided along with the administration of broad spectrum antimicrobial therapy. The treatment of healthcare associated infection depending on the underlying etiology. Due to increasing antimicrobial resistant pattern, antimicrobial agent should be used. Antibiotic susceptibility test and clinical response, as well as determining the optimal duration of antibiotic therapy, must be checked. Treatment depends on that causing agent. When isolated organism is bacteria, treatment begin with a broad spectrum antibiotic like penicillin, cephalosporin, tetracycline, or erythromycin. In the case of multi-drug resistant bacteria, vancomycin, imipenem can be used. Imipenem can be used. The fungal infection, amphotericin B, nystatin, ketoconazole, fluconazole, caspofungin, all the drugs recommended. In the case of antiviral drugs, acyclovir, ganciclovir, amantadine are used. So these are the drugs we take for nosocomial infection treatment. Thanks for watching.